China's CoronaVac vaccine has been endorsed by the World Health Organization. On Tuesday, WHO Director General Dr. Tedros Ghebreyesus said Sinovac is safe and effective. The UN health body also validated it for emergency use. Sinovac is the second Chinese jab to receive WHO's endorsement after Sinopharm, which was approved last month. The WHO recommends the Sinovac jab for adults over 18 years with a 2-dose plan and a 2 to 4 weeks spacing. Let's get more on that story now. We're now joined by Professor Shabir A. Madhi, who is a professor of vaccinology at the University of Witwatersrand in Johannesburg, South Africa. Professor, how important is this for Africa, which is lurking behind in its efforts to vaccinate its population?
Good day. So any new vaccine that becomes available for global use obviously is extremely important. And the Sinovac vaccine is no different from any of the other vaccines in terms of its possible use to reduce the number of people that end up dying and end up being hospitalized from COVID-19. The main issue right now is twofold. Firstly, I think there still needs to be some work that's done in terms of understanding how well the Sinovac vaccine, as well as a few of the other vaccine, works against the type of variants that are dominating in sub-Saharan Africa, and that is now known as the Beta variant, which was first identified in South Africa. And the data on that for the Sinovac vaccine, as well as a few of the other vaccines, is still relatively sparse. But that being said, the other big issue is how quickly Sinovac would be able to scale up manufacture and make the vaccine available to the COVAX facility, as well as to other countries that are wanting to actually purchase a vaccine. These sort of approvals are not going to be of much use if the companies aren't able to scale up manufacture of the vaccine immediately into the hundreds of millions of doses so that we can get it into the arms of people sooner rather than later.
Now, Professor, Egypt is expected to start locally producing China's Sinovac COVID-19 vaccine this month. How has Beijing helped to improve access to COVID-19 vaccines across Africa?
So that is welcome news. But at the same time, we also need to understand that if Egypt starts producing a vaccine now, it doesn't mean that the vaccine is going to become available in a month or two. It depends where they are when it comes to the technology transfer. And again, this is something which is a global issue as to what extent companies that hold the patent rights for their COVID vaccines should start engaging with other manufacturers in low and middle income countries, including doing the technology transfer. So while this technology transfer is important, it is not the immediate solution to trying to save lives from COVID-19. We would achieve much more if the current capacity in those countries where the vaccines are already being produced is expanded immediately. So the medium-term plan should be for African countries to be able to produce vaccine and become less dependent on other sources of vaccine from outside of the continent. But in the immediate future, the emergency that we face with is one that demands the scaling up of manufacture of vaccines in those facilities that are already established.
Finally, Professor, taking all this in, how will this then help Africa catch up in terms of vaccinating its population after lagging behind?
Yeah, like I said, it really depends to what extent Sinovac and the other manufacturers can scale up their manufacture in their current facilities. Waiting for the technology transfer to take place is not going to assist us. By the time we have adequate capacity to produce vaccine on the continent, the COVID-19 pandemic very likely would have passed already. So again, to emphasize that it's important that this vaccine has been now approved for use by WHO, but its public health impact is going to be completely dependent on how well the company is able to scale up its manufacture of the vaccine and make it available to low and middle income countries.
Professor, thank you very much for speaking to us on Africa Live. That was Professor Shabir A. Madhi, who is a professor of vaccinology at the University of Witwatersrand, joining us live from Johannesburg.